Migraines are debilitating headaches that often affect people on a daily basis. Usually the headaches start with an aura that comes on. There's a feeling of pain and an impending doom that happens. And that's followed by a one-sided pain, usually. And it's also associated with having dizziness, nausea, as well as vomiting. And some people actually can see lights flashing in their head, which leads to what's called photophobia. Or they may have chronic pain that can last anywhere from 2 to 3 days to every day of the month. So that's where Botox comes into play. What's fascinating about Botox is that it actually has multiple etiologies by which it can help patients with migraine. One of the clear ways that we know it works is that by blocking the neurotransmitters or the electrical signals that go to your brain, and by blocking those signals, patients can get relief. The second mechanism that it may be very active, and we know that it works, is by relieving and releasing the muscles that are compressing the nerves around your head. So some of those muscles are in the back of your head. For example, the nerve that comes up from the spine and goes into the back of your head. Another one is in the frontal area, which is the nerves that come from the eyes and go to the forehead. A third one is actually in the temples. So if you think about most patients that have headaches, they're either really in a lot of pain where they're pressing on their head up here, or they may have pain in the temples where they're pressing on it back here, or they may have pain in the back of their neck where they're pressing. Well, it turns out, and we know this anatomically, that these nerves are actually being compressed by muscles. And the idea behind Botox is that if you put the Botox in the right place, and if it's done by the right healthcare professional, you can actually relieve the pressure that's on these nerves and help improve your symptoms. And so Botox was FDA approved in October of 2010 for this purpose. There were a number of clinical studies that were done that showed that if you put Botox and it's in the right place at the right depth, it's extremely effective for patients that have chronic migraines. And I ask you to talk about it with your healthcare professional.